other form of myopied vesicles. It's not abuse. Last form of physical abuse, child abuse, is fractures. Not all fractures we consider it as child abuse. There are likelihood of fracture, likelihood of a fracture being due to non-accidental injury. If it's high or moderate or low. High likelihood to be due to non-accidental injury if metaphyseal fracture or posterior rib fracture. Like here, this one, you see left side, the chest wall, ribs. This is 6, 7, 8 ribs fracture with callus formation. Moderate likelihood of a fracture to be due to non-accidental injury if multiple fractures or fractures different ages or complex skull fracture. Like we have here an example. See here, this is a recent fracture, and at the same time we see here this one old fracture with new subperiosteal bone, new bone formation here. So fractures of different age. So maybe this is due to non-accidental injury. It's moderate likelihood. Low likelihood of a fracture to be due to non-accidental injury if for the clavicle or long bone, shaft, or linear skull fracture. Fractures, non-accidental injury, predominantly a problem of children under age of 30 months. 4% of supracondylar fracture humerus are associated with abuse. However, non-supracondylar fractures are associated. Over 5 years of age, most long bones fractures are accidental. You know, anterior rib fracture can be caused by abuse, but maybe due to CBR, don't forget. Like we have here, there is posterior rib fracture and also intermedial rib fracture. Okay. How to investigate this child with suspected physical abuse? If head injury in young child is suspected, non-accidental injury, so immediate computerized tomography followed by magnetic resonance image. Skeletal survey to exclude fractures. All infant. Coagulation screen and also ophthalmological examination, as we mentioned, for retinal hemorrhage. For all physically abused children under 30 months of age, full skeletal survey with oblique view of ribs. Some can be identified by radionuclide scan, or if X-ray is normal but still high suspicion of non-accidental injury, we can repeat X-ray 1 or 2 weeks later. At the same time, we have to consider and exclude osteogenesis imperfecta from the history and family history and examination. Also, copper deficiency, which is a rare, really. In case of child abuse with bruising, so we have to check coagulation screen. Maybe patient has bleeding diastasis and it's not child abuse. For scald and cigarette burn, sometimes may be misinterpreted by Ollas impetigo or staphylococcal skeletal skin syndrome. which is called 4S syndrome. So, diagnosis. For serious injuries, rarely the initial presentation. Almost always, serious injuries preceded by minor injuries. If a particular child in the household has been subjected to abuse, further episodes are directed towards the same child. Abusers do not usually suffer from mental illness, maybe normal. Postnatal depression sometimes contribute. May have experienced poor parenting in childhood. So some items with abuser, some items with the child himself. What are factors in a child which may be predisposed to abuse? These include young age, disabled child, low birth weight, or demanding personality. Other form of physical abuse is neglect. Neglect presented by failure to thrive, nobody take care of him, inadequate hygiene, like severe nappy rash, infestation, poor hygiene, delay in development, speech or language, poor attendance for vaccination at school, missed the vaccine for long, no attendance to school, nobody care, poor development of emotional attachment to the child caregiver. This is, you see this picture, for example, you see there's no muscle bulk, you see subcutaneous tissue, you see this nappy rash, fail to thrive. Lastly, in physical abuse, Munchausen syndrome by proxy, or factitious or induced illness. This is uncommon, fabricated by a parent, usually mother. Some of these mothers have connections with healthcare services. That's why these mothers have some idea. Examples: putting blood in vomit, stool, or urine. Placing sugar in urine to give you impression of diabetes. Contaminating microbiological specimen. Non-accidental poisoning, unexplained drowsiness after hypnotics or tranquilizers. There are some clues. Condition only occurs when parent is present. Suspected a frequent unexplained illness and multiple hospital admissions with symptoms that only occur in the mother's presence and not substantiated by clinical finding. Munchausen syndrome by proxy can be very damaging to the child, as unnecessary investigations and potentially harmful treatment. The child learns to live with pattern of illness, you see, rather than health. In induced poisoning, diagnosis is difficult, but can be made by identifying the drug in blood. Yani we are lucky if we see the drug in blood or urine. Another type of abuse is sexual abuse. What's the definition of sexual abuse? An involvement of dependent, developmentally immature children and adolescents in sexual activities that they do not fully comprehend and are unable to give informed consent to, and that violate social taboos of family rules. What are variety of acts? Whether genital exposure, involvement of pornography, genital, anal, or oral sexual activity, or intercourse including rape. All these are variety of acts. There are family risk factors. Poor parental sexual relationship, maternal depression or physical illness, mother sexually abused in childhood, family chaotic, disorganized or socially isolated, father or the abuser either inadequate or aggressive. Any of these factors just guide you to think of the sexual abuse as your case. How it presents? Usually as incidental allegation, disclosure by the child, or genital trauma or infection, sometimes sexually transmitted disease, highly sexualized behavior towards adults or children, inexplicable change in behavior or schoolwork, changed his behavior, we don't know why. At school he is different, or unexplained pregnancy. What's the clinical picture of sexual abuse? Maybe bruising around thighs, genitalia, perineum, anus, buttock, and lower abdomen. Maybe tears and abrasions to female genitalia. Particularly the hymen may be tall. However, vulval soreness is common in young girls and rarely due to abuse. And if you see vulva is sore, it doesn't mean it's abuse, because it's common in young girls, maybe for hygiene or infection. Also, tears and abrasions to male genitalia, anal fissure, reflex anal dilatation. Reflex anal dilatation and fissure in isolation are not reliable sign of sexual abuse, may be caused by other cause like constipation. Examination. Guidelines here in examination: when sexual abuse is suspected, urgent medical examination conducted by 2 doctors skilled in pediatric examination for sexual abuse, or by a single doctor, but he has to record the finding photographically by colposcope. Assessment of gross behavior development, examination of genitalia, only detailed inspection, and not an internal examination. Be sure. Examination is done as part of general examination. Genitalia is done as a part of general clinical examination. If the incident within 72 hours, so forensic swabs and samples should be taken. If the alleged abuse is less than, like we mentioned, 72 hours from the incident. Examination should be with the knowledge and agreement of the parents. Adolescent girls must give their consent, performed in privacy and non-threatening environment. Physical finding after full examination, you have physical finding only in 30% of sexual abused children. But normal clinical examination does not exclude sexual abuse. Physical signs must be interpreted in conjunction with the history. Further information from the child during interview with social worker and police officer. We have to collect all together. Secondly, physiological damage frequently occur. Sure. How to manage? Follow the procedure of local safeguarding children committee, full history and full examination in sensitive way, without being accusatory and commending. Any injury or medical finding you have, carefully noted, mapped, photographed with parental consent. It's a must, parental consent. Gross parameters plotted on the entire chart. We have to notice also interaction between a child and parents. All notes should be meticulous, dated, timed, and signed. Treatment of specific injuries should be investigated, blood tests and X-ray undertaken. If abuse suspected or confirmed, so we have to make decision whether immediate treatment is required, and if the child needs immediate protection from further harm. If yes,